Hi there, this is Justine Calderwood, physical therapist at Healing Spot Physical Therapy, and today for this little lunch and learn session I have planned, I want to talk to you moms out there about diastasis recti. Okay, so what it is basically the ab separation that can happen during pregnancy. So I'm going to give you a little demonstration here. I'm going to talk about what it is, how it develops, what we do as physical therapists to treat it, and also a little bit of prevention. Okay, so if you're pregnant right now, or if you are a mom and been pregnant in the past and you're worried about whether your ab separation is normal, if you should get it looked at, this video is for you. Okay, so I have a jacket on right now, or a sweatshirt, and I'm just going to zip it up to kind of show you just a quick demo. Okay, so this jacket kind of fits me, comfortably, snugly, right? But it's not overly tight. But if you're pregnant and you start, growing with baby, I'm going to use this. Imagine that you have this beach ball inside, right? That gets bigger. I'm going to use this blanket, but let's say, you put this in here. So I'm going to let the zipper help me out so you can see this a little bit better. So you can see now this is snugger, right? So if you can imagine, you have 4 sets of abdominal muscles, but the rectus abdominis go up and down like this in the front of your abdomen, okay? So if you can imagine them meeting in the middle of this, it's called a linea aba. But as baby grows, this starts to put a lot of tension through like the front, the zipper area, okay? Then the other thing that can happen, or that does happen, is if you add on, any kind of tightness in the low back, what that does is it starts to pull from the backside, okay? And it creates even more tension and puts more strain on this zipper area, okay? Another thing that can happen is if you are overly strong in your oblique muscles, so the oblique muscles run diagonally. So if you're overly strong, so imagine that's kind of like a pull up this way that also can create this separation, okay? So going back here, the other set of abdominal muscles are the transverse abdominis muscles. So they run low and they come and they attach onto the back, okay? So so you can kind of see how this can develop as pregnancy progresses, okay? So one thing that I was going to talk to you about, one, as a physical therapist, how we basically look at this, okay? I don't have somebody in my clinic right now to show you this, but what we do is we look at 4 things when we're actually looking to see, making, what do I want to say? We look at 4 things to chart progress, basically, to see if you're getting better, okay? So one thing that we look at, so if I were assessing a mom, I would have her lying down, and this I would assess postpartum, so after baby is born. I wouldn't do this assessment while mom was pregnant, okay? So I just want to clarify that. So I would have somebody lying down, and I would actually feel around the belly button, and I would put my fingers there and ask mom to lift her head. So if you've ever had that doming sensation, or when you kind of lift your head, or if you've done any sit-ups after pregnancy, after childbirth, and you've noticed that your stomach is no longer like flat like it used to be, regardless of how big it is, but I'm talking about that doming that happens, that bulging out, that little like alien baby that you feel like you still have in you. That's what I'm talking about. That's a sign that you have a diastasis recti. So what we do is we put our fingers in that area and we check at the belly button, we check above and below, but we're checking for 4 things. 1, how wide is it? Okay, so can I fit 1 finger, 2 finger, 3, 4? Okay, and obviously the wider that separation is, the more severe it is. Another thing that we look at is we measure how long that is. So is it pretty short, or is it, how long is it? We also measure how well those muscles can approximate again. So how well can that gap be closed, okay? So that's really kind of an assessment of the tension that you're able to generate by using these transverse abdominis muscles, okay? Because that tells us the prognosis, like how well can you recover from this, okay? And the other thing that we look at is the depth. So how far does my finger go down in? Is it to this first knuckle, second, all the way in? So again, that just it's just a way of charting progress over time. If you're watching right now and you have any questions, please leave them below and I will answer during this video. If you're watching this as a replay, just leave me the questions and I can answer them later. So as physical therapists, we can treat this, how do we treat it? Okay, so one is we can treat this in more like prevention. So if you are pregnant and you're worried about this and you're kind of noticing that this is happening, get in to see. You know, what I would do as a physical therapist that does a lot of myofascial release is I would actually address the tightness into the oblique muscles, into the fascia in the backside, and that can be done with mom on her back. You don't have to lie on your stomach in order to get that type of treatment, okay? And then I also would teach mom how to engage these transverse abdominis, okay? So that it's kind of like your own natural corset for your back, and that's true whether you're pregnant or not. The transverse abdominis are very great muscles to be able to contract in order to provide this support for your back, okay? So that's one thing. And then also just looking at mom, giving her some tips on how to move, how to stand, and those kinds of things, and looking at her posture so that she can correct some of this and prevent this from happening, or prevent it from happening to such a high degree. Postpartum, how do we treat this? Same basic things. We're still looking at the oblique muscles, we're still looking at the thoracolumbar fascia back in through here, and opening that up from the back so that that zipper is able to approximate better, so you don't have all this tension coming from those areas. Another thing I didn't mention was, a lot of times as baby grows, we get this rib thrust where if you could look at from the side, you start to get this extension as the ribs open up and as the organs move up to accommodate growing baby. So we address that rib thrust as well and bring balance back to mom's body that way. Activity modification, how to turn in bed, how to stand, those kinds of things that can help to support this so that you're not stressing your body and you allow your body to heal. And then again, that core strengthening where we're really focused on the pelvic floor, the transverse abdominis, so we're bringing balance back and getting the right muscles to be strong and not emphasizing muscles that could actually make this a little worse, okay? And then guiding moms on safe return to exercise, okay? That's also super important after having a baby, so that you're not just jumping back into exercise thinking that that's great, that you're doing the right types of exercise. So that's just a little information on diastasis recti. If you are concerned about this and you do want to get checked out, please reach out to me. I would be happy to meet with you and give you the more information, and certainly treatment if that's the route you'd like to go. Stay tuned tomorrow. I'm going to do a Teaching Tuesday where I'm going to actually go over just a couple tips that moms can do postpartum to help them heal from this, okay? So check in tomorrow. I will be posting that on Facebook and Instagram. And thanks for being here, and thanks for watching. Bye-bye.